Welcome to the Egg Whisperer Show. I get excited when I invite guests on, but Dr. Karen Tang is someone that I've wanted on for so long. Karen, thank you for joining me today.
I am so excited. We were just talking before we started recording that Dr. Vazadeh and I went to the same residency program, except I just missed her. You finished right before I started. And so I've known about you for like 15 years, 20 years, 20 years. Oh my God, it's been a long
Yeah,
time.
yeah,
Oh, but yeah,
it's
I've
so
known of you
long.
for years and years, and you've done such amazing things. So I've been wanting to do the show for a long time.
Aw, same. Well, thank you for coming on. And we have something very special to talk about, and that's your book. It's Not Hysteria, everything you need to know about your reproductive health, but never were told. So I'm so excited to dive in. But before we do that, I just want to share with our listeners a little bit more about you and your background. So Dr. Karen Tang is a gynecologist with over 15 years of experience specializing in endometriosis, fibroids, chronic pelvic pain, menopause, and gender-affirming care. After completing her MD and MPH at Columbia and training at Harvard Medical School and Legacy Health, she established Thrive Gynecology in Philadelphia, where her expertise attracts patients nationwide. Very well known for her advocacy and expertise, Dr. Tang also consults with the WHO and trains future OBGYN specialists, positioning her as one of the most prominent voices in women's health today. She's the author of It's Not Hysteria, Everything You Need to Know About Your Reproductive Health. Welcome again, Karen. What led you to write your book? And can you share why the title, It's Not Hysteria?
I love this title so much. And so the book is something that came out of the years of practice. As a specialist in pelvic pain and endometriosis. I was just seeing like almost every patient in my office had gone for years and years. On average, it takes 7 years for someone to get a diagnosis of endometriosis. Seeing doctor after doctor, going to the ER, being told, well, we're not seeing anything on your ultrasound, your tests are normal. So it must just be bad period pain. And maybe you just have to just kind of deal with it a little bit better. And it turns out that they actually had a very serious medical issue. And that is the case for so many things in gynecology, that women will really struggle for a long time before they get answers and relief. And that, obviously in your field with fertility issues, with period problems, with menopause, perimenopause, across the board, this is something that so many women and people assigned female at birth are facing. And hearing all the stories of frustration over the years, wishing that I could do something on a bigger scale to help educate and help to, just pave the way so that people didn't have to struggle so hard just to get the basic care that they need. So, social media kind of came along and gave me a platform to educate. And that led then to the book. I was so excited because I've always been more of a writer than like a video person, which is ironic because I started doing the videos before I wrote the book. The videos and the social media led to the opportunity to write this book. The original title, it was actually something much more prosaic. It was like periods, pain, empowerment, very alliterative. But, talking with my team, they're like, oh, what about the name? It's Not Hysteria. And I'm like, that's amazing. Because it's not just like an encyclopedia of facts. It's also the history. Why is it that women have struggled basically through all of human history to get taken seriously? The word hysteria has so many levels to it. So it actually comes from the word for uterus in Greek, hystera. That's why we say hysterectomy. It comes from the same kind of base word as hysteria. Then you had Sigmund Freud. You had all these women being told you're just like super anxious and you've kind of manifested your physical problems. And then that sort of is still lingering today. So the name captures so much, not just about the history, but just how people are treated today. Like sometimes it's just you're so anxious. Maybe you just need to like relax a little bit. When it's actually medical problems that deserve treatment.
Right. It's a lot of gaslighting. And your book serves as a great instruction manual for patients. So I'm looking forward to having you share more about that. And you're a myth buster as well around reproductive health. And we obviously both share a love of being fertility myth busters. What would you say are some of the misconceptions that women believe about conditions like what you just mentioned, endometriosis, PCOS, which stands for polycystic ovarian syndrome, or fibroids?
hmm I mean, where to even start? I think probably the biggest overarching one is that's normal. You get that a lot where people are like, well, that's just periods. That's normal. It's hard to get pregnant. Don't talk about it. There's a whole lot of these like, one, it's normal. Two, it's shameful and don't speak about it. So they kind of go hand in hand. I say this in the book that a lot of these conditions like endo and fibroids run in families. So then it is that like literally everyone in the family family truly does have horrible periods. And then, well, that's just how periods are. And so it gets passed down from generation to generation that throwing up, bleeding all over the place, like soaking through your pants is just part of the experience of having periods. And so a lot of patients, when they come see me, they're like, oh my God, that's not normal. I'm like, no, it's not normal. Like other people don't bleed that much or have that much pain. And the shameful thing is something that it just kind of gets reinforced right from the time people are kids, like in school, joking about period products and like, oh, you're PMSing. It gets absorbed into your psyche that like, that's embarrassing. Don't talk about it. Just hide it away and just try and deal with it as best you can. And so that then I think contributes to people waiting and struggling so long. And that gets absorbed by doctors too. Like doctors are like, well, it's just periods. Everyone has a bad period. That can be a barrier to then helping figure out what's actually going on.
Yes, I'm hoping that you and I both can change the way that doctors take care of their patients as well. And patients, once they learn about the information you share in their book, then they'll talk to their family members, educate their friends, and hopefully you'll create a revolution.
Yeah, we're trying.
But
It's one
it's
of the coolest things I hear is when people say, "Oh my, I'm getting this book for my daughter because I don't want her to suffer the way I did, and I want her to be educated about her body right from the very beginning." So that's so exciting. I get a little emotional whenever someone says that to me. I'm like, "We're going to change the future." Like, it really is very exciting. Oh, and the other thing, really quick, is the myth I love debunking is that it's supposed to hurt, and that it can be related to periods, to sex. That gets, oh my gosh, it gets perpetuated. All this like sex is supposed to hurt. You're supposed to just kind of like tolerate it or maybe drink some wine and relax. If you're getting really bad pain with periods or with sex or with anything, exercise, that's not normal. Even if something's common, it doesn't mean it's normal or okay. And there's oftentimes a reason for it. So pain with sex, it could be endometriosis, it could be pelvic floor spasm, vaginismus, vulvodynia, perimenopause. I mean, it could be like a whole bunch of things. So the punchline is you don't have to just deal with it.
And you mentioned that sometimes healthcare providers, doctors, they're well-intentioned, but sometimes they perpetuate these myths as well. Why do you think these conditions continue to be frequently misunderstood?
I say in the book that healthcare providers are just human beings. We sometimes will absorb lessons from training, from other doctors, without realizing that it's an opinion and not like based on actual facts. And so, this is something that like you see all the time, like that, like maybe a more senior doctor will say something, and then the next person will kind of say, "Oh, okay, well that's this very learned and experienced doctor believes it, and so it must be true." So, for instance, like with endometriosis, I give the example that we love in medicine something with objective data where we can see, oh, this EKG is abnormal or this blood sugar is abnormal. We don't love uncertainty and we don't love something that causes lots of symptoms but doesn't have a positive test that says, yes, this is what it is. So, endometriosis, unfortunately, doesn't have a test except for surgery. It might show up in the form of an ultrasound if you have, say, endometriosis cysts in your ovaries, but a lot of people with endo have totally normal imaging studies. So the only way to find is with surgery. So you end up with people who have completely normal ultrasounds, oftentimes nothing that you can feel on their pelvic exam. Their blood tests are normal, but they have tons of symptoms. So they have period pain, diarrhea, bloating, nausea, vomiting, fatigue, migraines, things that seem to not make sense to be part of the same condition. But because it causes so many things with totally normal results, then you get this, well, it must be somebody's just a hypochondriac. It's in their mind. Whereas, it's unfortunately just something that doesn't have an easy test. And there's so many things in GYN that are like this. There's pelvic floor dysfunction, perimenopause. Oftentimes people in perimenopause have rock solid normal labs, but they are feeling all the symptoms of menopause. So again, people are like, well, you're not in menopause, your labs are normal and you have pretty regular periods. So it must just be in your mind. So I think that's part of the problem is we don't love in medicine that kind of sense of, well, we didn't get like a positive test result that confirmed it. And that then leads to the jump in logic. Well, maybe it's just psychological.
That's a great way of explaining it. I've never heard that explanation, and I'm just learning so much from you. And now I'm not going to be as mad at the doctors that tell my patients things like endometriosis does not affect your fertility
Oh
because
my gosh.
it
Oh,
does.
that makes me mad. That's
It
like,
makes me so mad, and
yeah,
I'm like, where are you getting this from?" And I understand it's probably from the senior physicians that they
yeah.
trained with that
Mhm.
told them that endometriosis does not affect your
Which
fertility.
is wild. The other thing too is that people get told told still to get pregnant to treat their endometriosis. I thought this was sort of a myth that, like, obviously I had never heard someone say that, but then so many people in my comments of my post were like, oh my God, yeah, to this day, like people are still telling me this. And, you probably have endometriosis, just go get pregnant. People do, for those listening, people do temporarily feel better in pregnancy because they're not ovulating, they're not having periods, they have progesterone, which suppresses the endo. But it's not a like sustainable solution. Like you can't just be like, well, I guess I'll just get pregnant and stay pregnant for 20 years. That's not like an actual like viable solution for people's problems. But again, that little tiny myth, like, oh, what are the treatment options for endo pregnancy? And that just gets perpetuated and people
Right.
pass that along.
And then that results in delays in fertility care that I imagine you see as well.
Mhm. Nobody goes into OBGYN or medicine or ER, anything, intending to be a bad doctor. It's not that they're sort of purposely not getting to the right answer. It's the system. So again, they're sort of just the victim of the system, just as much as women are. That, in addition to the myths getting perpetuated, there's a lack of research. So we don't have amazing algorithms like we do for, diabetes or cancer. There are these beautiful, well laid out algorithms. You do this test, you get this finding, and then you do this thing. And so it's very straightforward. So there's a lot of like expert, opinion management in women's health. And the other thing too is the system is set up so that most general OBGYNs only get like 15 minutes per patient. Like the reimbursement's really bad. They have to see a lot of patients to survive. And if the more patients you see, the less time you have. And then it's too hard to kind of sift through a very complicated issue like fertility, hormone issues in like 15 minutes. And so people end up feeling very dissatisfied. They leave the doctor being like, oh my God, I asked one question. They were like, we don't have a great answer for you. And then that was the end of the appointment. And they didn't really, get to dive in. And that's, again, not the fault of the doctor. That's the system. So, I do always have the caveat. Sometimes like, in these talks, we're like, this is just a mess. And I don't want to make it sound like, oh, our fellow OBGYNs are like being purposely bad at helping. But it's just the whole system is just set up to not support women to get to the answers they need.
Exactly. I say they're well intentioned.
Yes.
They're not intending to delay your access to fertility care.
Mhm.
It's just not set up for them to spend the time that they would need to give you the best advice.
Exactly. Yeah.
And in your book, you emphasize the importance of women being their own health advocate in these visits that women have that may not be very long. Could you share some of the key questions or prompts that you suggest readers bring to their doctors so that they can get the best care in that short period of time?
Yeah. And this is so important. The other reason I say that my book is not like an encyclopedia, it's supposed to be practical in that it's not just dry facts. It's like, well, what do I do with this now? So that I can take this into my doctor's visit and make my appointments really work for me better. So the first thing is kind of just to like be able to take stock of what is going on with you. So a lot of people are like, is this normal? Is what I'm going through, is this okay? Or is this abnormal? So just kind of reading through and understanding like what is a normal period? Like what is, the pathway to fertility? Like when should I seek out fertility care? Like just to take stock of what they're going through and say, yes, actually, these are things that are concerning. I should really get this addressed. And then keeping notes, like, writing down your notes, keeping like organized so that you can jump in. A lot of the time, when somebody comes in cold to a doctor's appointment, like they're spending time kind of just trying to draw out the history. Like, tell me about your periods, tell me about trying to get pregnant, how long have you been trying? If you can kind of just jump in and be like, my cycles are like this, we've been trying like blah, blah. It just kind of like jumps you ahead. It like takes that precious couple of minutes that the doctor may be just like trying to pull out the information and just kind of presenting it to them right off the bat. Sometimes if you're like something is going on, like at least having like a general idea of some possible things. I am having some facial hair and some acne. I'm skipping a lot of periods. I'm having trouble losing weight. Like I think I could have PCOS. Again, that just like jumps you ahead like 15 minutes into the appointment. You hit the ground running, so to speak. And then also, like, if you have specific questions about different treatment options, about, medication, surgeries that you may have kind of heard about that might be options for you, again, that makes the best of use of your time. And then also telling the doctor what your goals are. So, for instance, with endometriosis, it's very different if someone is wanting to get pregnant right away versus someone who knows they never want to get pregnant. Maybe they have adenomyosis, which is like endometriosis of their uterus, and they might want, say, a hysterectomy, which obviously we would never do in someone who wants to get pregnant. So telling your doctor what your specific goals for your health are, what your perspectives are on fertility, on medications, hormones, surgeries, that just helps them to kind of triage what might be the best fit for you. So I always tell people, before you come to my office, I have no idea what you're going to choose, because so much of it is based on your values, your goals, your preferences. So I'm not going to know until you come in and you say those things what the right plan is for you. So being very clear with your doctor about your goals, your preferences, your beliefs is going to really help them to tailor their recommendations.
Okay, you guys heard it here. Goals, preferences, beliefs. Make sure you know those three things before you go into your next doctor's office visit. And that's super important. I think a lot of patients assume that there's some sort of national database that we can log in and we know everything about them up front. And when they come in, everything is very obvious to us because we've access to all their records since birth. And so that's why I think, yeah, it would be so nice. But it's important to be the owner of your own records, be the CEO of your medical health, and take control, take careful notes, just like you
Mhm.
said.
And then the records is important. That's actually a great point. I don't think I've ever actually brought that up in a podcast, but I always request records for things like imaging, hormone lab tests, prior surgery, like reports from surgery. Because, like you said, that we don't have access to, your prior records. And so much of the counseling is based on what is already has been done, has been seen. So again, that will definitely save precious time in your appointment if you can get those. And I tell people, yeah, keep a file for yourself. A lot of times people are like, oh, the doctor's office is faxing it. I will tell everyone, and this is across the board, it's not one specific doctor. It's just people are busy, and maybe like half to 75% of the time, we never actually get the records. So just keep a file for yourself if you're moving, just so you have it on hand.
Yeah, and if they say they faxed it, confirm that it went through. So you mentioned the lack of research funding and limited education around some of these common reproductive health issues. And they're so common, things like pelvic floor dysfunction or PMDD. And these can have a significant impact on a woman's overall well-being and quality of life. Why is there such limited education and research funding?
I always tell people it goes back to what people think is real medicine, like what's important, what is really worth the NIH funding and the resources of an academic institution. Most funding, for major medical studies probably comes from the NIH. It's the major funder of medical research in the world, not even just the United States. And when I was writing the book, I had done some reading about disparities in research funding. And I saw some statistic about the funding for something like Crohn's disease compared to endometriosis. Crohn's disease affects many fewer patients than endometriosis. Both are very debilitating, can be very, significant pain and suffering and things. But Crohn's gets way more funding. And I was like, as I was looking this up, because the NIH funding is actually public data. So you can actually look up literally every single topic that they funded and how much they've allotted to it. So I was like, let me just look and see what the craziest thing is, that there's NIH's funding and it's funding a lot compared to women's health, and smallpox. So I put this in the book because I could not believe this. Smallpox, which was eradicated in the 1940s, so no human being in the United States has had this since the 1940s, had more, much more. I think it was more than twice, or many times the funding of endometriosis, which affects at least 10% of women. I think it's a lot more. Fibroids, which affects up to 80% of women, 70 to 80% of women have fibroids at some point. And the smallpox funding was like 3-4 times, it was many, many, many times the funding for these active women's health problems that cause such significant quality of life issues, can cause infertility. And I was thinking, it was like, why are they funding smallpox? It's because it's probably for national security, biological warfare. Again, these are things that are thought to be important. This is what we need to put money towards. Or, things like diabetes, which is obviously a major medical issue. But, PCOS, I think, has more, in reproductive age women, PCOS is more common than diabetes. Why is diabetes have many, 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 many more times more funding than PCOS, which again causes infertility, can cause all sorts of quality of life issues. So right from the beginning, when people are deciding what is worthy, what is worth allotting money to, what is worth, making my career about, it comes down to what you think is real medicine. So you have cancers, you have heart disease, diabetes, stroke, high blood pressure, anything heart related. They're like, "But that's serious. Like that can kill you and making your life completely miserable and taking away your fertility and your quality of life, your ability to work is not worthy." So, I don't know if you ever had this experience in training, like where people said, "Oh, why are you gonna go into gynecology? You could do a real profession." You know what I mean?
Our attendings used to say, "Amy, you have the hands. I have man hands." It's like a running joke. Not a running joke, but it's a serious thing. I have the largest hands of any woman that anyone has ever seen. So everyone said that it was a waste for me to go into reproductive endocrinology, that I needed to do gynecologic oncology or be a surgeon because I have such big hands for a woman.
I think everyone who's gone into OB/GYN was told at one point, "Well, why don't you go into cardiology? Or if you're a surgeon, like you could be a real surgeon. Why are you going into GYN surgery?" As if, like operating on a uterus was not as worthwhile as operating on bones or like a
Right.
penis. So I'll tell your listeners too, you may not know this, that reimbursement wise, again, everything comes down to funding. Reimbursement wise, basically everything in urology reimburses higher than the equivalent in GYN. So, like, prostate biopsy versus endometrial biopsy, vasectomy versus tubal ligation, literally every single thing equivalent wise, the value assigned to the urology version is much higher than the women's version. And literally based on nothing else except for the gender, the sex of the patient. And again, it doesn't come down to difficulty. Tubal ligation takes a way more time and complexity than a vasectomy does, but vasectomy gets valued higher. All of these things comes down to the dollars. And then medical system will say, well, GYN is losing money, but orthopedic surgery and cardiothoracic surgery make a lot of money. So we're going to put more research toward it. We're going to put more of our institutional efforts and all of that stuff towards the thing that bring in revenue. So all of these things, it's just a big, huge, crazy cycle. It comes down to value, what we think is important.
Wow, this information is stunning. It's surprising, it's so interesting, and it's frustrating and infuriating all at the same time. It's like the gender gap and the disparity. It's not just women trying to seek care, but it's also the gynecologists trying to provide care
Mhm.
that are suffering too. That's insane.
Yeah.
And then women
We're going to bring
suffer.
this to a
Their patients
positive
suffer.
place. I always tell people sometimes like these
Immediately,
talks.
immediately, right now, because we're gonna change how doctors treat their patients
Exactly.
by
Yes.
so many people are gonna listen to this. They're gonna go to their doctors. They're gonna
Mhm.
educate their doctors. Hey, maybe buy your doctor this book.
Yeah. 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 Yeah.
Okay. If you're
And
listening to this, buy it for your primary care doctor, buy it for your OB/GYN. I think it's a great book for them to have. And I want to talk a little bit about primary care doctors because so many patients go to their primary care doctors first, their family practice doctors, their internists. And what do you wish they knew about gynecological and fertility care?
this is a great question. And so, a lot of things in GYN, people will actually go to their primary care doctor first because sometimes the symptoms, manifest as something that you wouldn't think of as a women's health issue. So, for instance, endometriosis, a lot of times the bowel stuff is so bad that they come to their doctor because they're like, I think there's something wrong. I'm having all this diarrhea or I'm having horrible pain with bowel movements, constipation. You might not even put it together that it's a women's health issue. So one is for primary care doctors and pediatricians who are seeing like the teenagers who are having period problems, like severe pain, just to have that awareness of these issues. So I would love it if like primary care doctors, ER doctors, I actually say in the beginning of the book that a lot of times the specialists who are seeing these things first are not gynecologists. So yeah, ER doctors, primary care, pediatricians, even mental health professionals, that if you're seeing these patterns, like have a low threshold to be like, that actually rings a bell for something like endometriosis, PCOS, fibroids, like let's get a pelvic ultrasound, let's get you to the gynecologist. And, not to just sort of say, well, I don't know, it's just period stuff. But to help facilitate. And I've gotten so many amazing referrals from pediatricians, from physical therapists, believe it or not. I actually quite a few referrals from physical therapists who are like, I think you have endo. And then it's true, they do. Just having that knowledge of how certain things can manifest and then facilitating referrals and getting people to specialists too. Because sometimes, again, if someone is like, well, I saw my OBGYN, they kind of dismiss me. Knowing who in the area is a specialist in fertility issues and reproductive endocrine issues for PCOS, those who are trying to get pregnant, and knowing obviously that I'm sure you've told this a million times on your show, but like if you're like over 35, you've been trying for more than 6 months, or if you're having issues like missing periods, really painful periods, go in sooner, kind of having an idea of like, when do you refer, who do you send them to? So the book also goes into that, like, so, what point does someone need, fertility evaluation? What type of doctor do they see for different GYN issues? And yeah, that makes such a difference. It just like fast tracks people from trying to figure the system out
Right. And sometimes
themselves.
your acupuncturist knows. I get a lot of referrals from acupuncturists. I'm sure you do too, where the acupuncturist is the one that sat down, listened to the patient, they take the time, talk to the patient about their goals, and then guide the patient to the right specialist.
It's amazing. And yeah, the pelvic physical therapy, I send everyone for pelvic PT, but a lot of times, say someone will get referred because they have like urine leaking, they have some urinary incontinence, but the physical therapist takes a whole history. They ask about pain, they ask about like functions of their bowels and bladder, and they're like, those are symptoms of endometriosis. And they'll send them, and it's amazing because the patient's like, I didn't even realize. Like, yeah, they're like, I went to see the physical therapist because I was leaking when I coughed, but then they unearthed this stuff that no one else had gotten to. They're really heroes for doing that.
They are. They truly are. So tell us more about where people can find you, your work, and your book.
Yeah. So I try and keep it simple. So everything is under at Karen Tang MD, Karentang MD. And I have a website that kind of links to all the social media, to the book information, and to my medical practice. So I'm outside of Philadelphia. Again, the practice is called Thrive Gynecology in Bryn Mawr, Pennsylvania. And it's just me and my amazing nurse, Tamika, and we love taking care of patients. We spend a lot of time with folks. So you can both see me if you want to see me as a doctor, but also you can find information about the book and link to all of my social media platforms. So I'm most active on Instagram. I am on TikTok, but mostly active on Instagram, do a little bit of threads and that sort of thing. And then, I need to resurrect my YouTube channel. It's been a long time. I need to go back and do that as well. But then the book, It's Not Hysteria, is available anywhere you buy books. So obviously, if you have a favorite local indie bookstore, you request it there. I believe it's available at every Barnes and Noble, which is pretty exciting. And then, like I said, you can also get it on Amazon. And I have an audiobook version, which I narrated. I didn't realize before that a lot of people who do nonfiction, they prefer it on audiobook. They throw it on their
Yeah.
commute and just listen.
Yeah.
So
Yeah.
it's available like that too. And look forward to connecting with you there.
Awesome. Well, thank you, Karen, so much for all your work,
This is so
your
great.
advocacy, the education, your mission. You're amazing. Is there anything else you'd like to add today?
I think that's it. Just you deserve
Okay.
the best. I write in when I sign books at book signings, I say you deserve the V best, like a little joke on the V. But you do. It's like we all deserve more. I think we deserve to, have the best possible care and to feel encouraged and supported in what we do as we're, trying to meet our health goals or fertility goals. So, you deserve that, and it's out there. So if you've hit some roadblocks along the way, just keep on going. There's definitely doctors out there who want to help and that there are answers for you. So thank you so much for having me on. This was so great.
Thank you, Karen. Thank you so much. I appreciate you. Thanks
Of
again.
course.